reason that I was asked to share the stage tonight is again because I'm a grateful recovering addict, and because I am an example of someone who, in the throes of my disease, is capable of terrible things. And I've benefited from the resources in the area, and I'm currently recovering from my addiction. And there are a lot of us here in recovery tonight. We're peppered throughout the room. And if you can't see, we wear these green dots on our name badges so you can come ask questions. They've all got great stories. But if you can't see the name tags, you'll know because they're the ones high-fiving and complimenting each other on how good they look in their suits. So when I was out there, I couldn't pay the bills. I couldn't keep an apartment. I couldn't keep a car. I didn't take care of my health. I suppose I finally got to a point where I'd had enough. And I think the question that I get from a lot of people working in recovery and dealing with families or other addicts, it's like, well, you know, how did you get to that point? What was that point? And it's a really hard question to answer. I think maybe I'll start with the things that didn't get me there, which I started using when I was 13. I grew up in an upper middle class family to a great home, and the discipline issue started immediately. I immediately addictively started using. I don't think I knew that that's what it was yet, but the minute I first drank or smoked pot, I was off to the races. All of a sudden the grades immediately started dropping. I got kicked off student council. I barely stayed on soccer teams. I had, I think, the second most detentions in the history of my school. I barely graduated. My parents were begging me to stop, and I didn't. I couldn't. I got diagnosed with cancer my senior year, and I beat that. I'm in remission. I didn't take it very seriously. And then my mom passed away when I was 19, and she never got to see me sober. I didn't know how to deal with that, so I started doing more drugs. I started using cocaine and alcohol a lot more at that time. My dad was alone. He started getting sick. He actually had ALS. We didn't know that at the time. I should have taken better care of him, but I didn't. Wasn't capable. Still caught in my addiction. Then the legal trouble started. I got arrested a lot. I got on probation. Could never walk it down. Started doing weekends in jail, then 90 days, then 120 days, and 6 months. Then I did a 2-year stretch in the pen, and I got out, and that still wasn't enough. My family that I had left was estranged. My friends could not understand. I was overdosing regularly. People were still begging me to stop. I got involved with crime, selling drugs, selling guns, becoming violent, doing all kinds of organized, terrible things. I was an absolute monster. Eventually homeless. And I guess it was at that point that I can say it still wasn't enough. Add a few more days. On April 27th, 2014, something changed. I hit bottom. That day I knew that I could no longer stop using alcohol and drugs, and because of that reality that I was actually going to die from it. And I wasn't scared of dying anymore. At that point I was more scared of living another day the way that I had been. That day I began a program of recovery. I went to MIRA, the Menzies Institute of Recovery. I spent 21 days there and got medically detoxed. I attended every group they offered. I learned about the disease of addiction. I needed that education that I acquired on how drugs and alcohol affected my brain differently than normal people. Concepts like a disease of choice, where I learned that these substances affect areas of my brain responsible for making decisions. The concept of a hijacked brain answered questions that had been shaping my self-worth since I had been about 13. I began to understand the disconnect between my values and my actions, the way that I hated using drugs and all the manipulating and cheating and stealing that came with it, but could not stop because I was a slave to my cravings, the phenomenon of cravings that Percy helped me understand. He's got a whole pitch with stuff like that. So slowly those feelings of frustration, self-hate, guilt, shame, grief they transformed and were replaced with something like determination. And so I had some understanding at this point of what I was going through, but it took me a while to give up the control of my life, to start listening to professionals and start taking suggestions. I was not an easy patient at Mira. You can ask the staff here. I would rather you didn't, though. At the end of my 21 days, when I was setting up my discharge plan, just trying to figure out how I was going to do this differently this time, I had 4 people in the room. I had my aunt, I had my uncle, I had my caseworker, and I had John Stuckey. And that was the first time I met John Stuckey. John Stuckey's sitting over there. He looks like a mix between Dr. Evil and Highway Patrol. Seating chart tonight, so if you're looking around and wondering why you don't have any pretty nurses at your table, it's because you fogged them all. So my best plan, my best thinking over that 21 days is that I was going to get out, get a car, grab a job in a restaurant, maybe bartending, whatever. It was all I really knew. Get an apartment and try and stay sober the best I could. That was my plan. That was the best that I could come up with, and it seems to make a lot of sense to a lot of people, but not to addicts and tobacco. John looked at me and blinked and said, "That's a terrible plan. You're not going to do that. Here's what you're going to do." He said that I was going to get my first Vivitrol injection that day. He said that I was going to move into his transitional house and I was going to start doing an outpatient program, and we'll deal with the rest later. The people in that room that day became my first support system, my first team. Later, now that it's been almost a year, and I've got a little time between me and those days, I can look back a little further and see that I had a much bigger team. I had a lot of people that had been on my team for a long time, but that was the day that I decided to join. From then on, I was building my support system every chance I got. The transitional house at Lewis Place was instrumental. That's 11 guys under one roof, all in different levels of recovery, holding each other accountable on a daily basis. This was irreplaceable and still is in my early sobriety. I know that the tackiest thing you can do when you have a microphone in front of you is to do shout-outs, but I love my Lewis A guys. I attended and I completed our outpatient program. I started exercising. I continued getting my Vivitrol injections. I utilized other steps in network of recovery. There was 12 of them to be exact. And I began to value my service work and passing on what I learned to others. This has opened doors to me that are truly remarkable. It's my experience that one addict can gain the truth and trust of another suffering addict in 30 minutes, where it may take another person, like a counselor, a caseworker, a nurse, or a doctor, 30 days to achieve that level of trust. Is that fair? Of course not. It doesn't make a lot of sense. But instead of fighting it, organizations are starting to embrace it. And they're starting to utilize peer facilitators in inpatient and outpatient treatment settings. And this allows recovering addicts like me to bridge the gaps between patient and staff. And today I wanted to call a lot of those teachers and my instructors and my coworkers. Something else I want to get into really quick is maybe one of the misconceptions about addiction, which is that you can do it on your own, or one addict can't help another one. No one beats addiction on their own, ever. I know, I tried it 1,000 times. I tried substituting, I tried bargaining. I tried marking days on calendars and then marking them back again and back again. I tried weaning myself off, tapering down. I turned off my phone and locked myself away. But I was the problem. I always got in the way of my recovery because my brain is sick, my decision-making process is broken, and inevitably I would convince myself that I could use just one more time. And that's where I think the value is in the clinical staff and the trained peer specialists, and they become indispensable in addict recovery up front in inpatient settings. I know tonight that there are a lot of people in this room who have lost someone close to them as a result of drug and alcohol abuse. I know that there's parents that have lost their kids. I know that there are sisters that have lost their brothers. My friend Jason lost 6 friends in the last 2 weeks to overdose. We're witnesses to a public health epidemic that is addiction. ARCHway believes that the system may be broken and they want to provide a solution. In 2009, 23.5 million people ages 12 and up needed treatment for addiction, and of that 23.5 million, only 2.6 received it. And state-funded programs are using $3 out of every 100 donated towards treating addicts, and there are 4-month waiting lists to get into recovery centers unless you have the cash in your pocket. If you have the cash in your pocket, I promise you, you're not driving to rehab. ARCHway Institute thinks this is unacceptable and is creating new solutions. John, Dan, and Jan Stuckey are assembling an inspired, understanding, and qualified board to facilitate the change. I've met them. Their passion is contagious and it has infected every volunteer from the top down. Every chance I have to volunteer and do something for this organization, I'll do it. I'll do whatever they ask. I'll talk in front of 150 people when I never have before because they ask me to.
Thank you.
I believe that ARCHway is the answer in our community to this epidemic, and it aims to be the link between the suffering addict and the resources necessary to facilitate their recovery. I've benefited directly from this organization and the volunteers who make it up, and here I stand recovering. Sober for the first time in my life and happier than I've ever been. One addict at a time, one day at a time, this is how I do it. But tonight we have the opportunity to impact so many more. In the last year I've learned a lot of things. I've learned that miracles can happen. I've learned that recovery is in fact real. I also go to church on Sunday. I think that if I pray a lot more, my days go a little bit smoother, which means that I believe in God. But I believe that God is a three-letter word for a concept much, much larger than we understand. But I know that He's real on a night like tonight in the smiles of my friends and in the generosity of strangers. Thank you very much.